Hello and hello. I was going to say hello, good day, and good afternoon, good morning to wherever you are. I guess I've said it. This is the Kosh TV on YouTube. My name is Janet, a registered RGN, ED, and a critical care, which we normally say as ICU care trained. And you can always add a health advocate. Today, I am going to use this word or words borrowed from a couple of vloggers, which is the mixed bag. Okay, I'm not going to go clinical per se. It's just going to be everything from health assessment, the community, how the system works, and how it affects us one way or the other. So I'll say shout out to all the members of Kente of Experts Club International. And a special shout out to you, Isel. Thank you so much for your feedback. I will work on those, and I really appreciate your contribution. Okay. So, the mixed bag. It's going to get a few people talking, I'm sure, but it has to be said. I would first start with self-assessment. Self-assessment as self-assessment for individuals, for self-assessment for health professional, health personnel, for the one who lives in the community. As a health expert or a health professional, or should I say a health personnel, however you choose to term it, with a special attention to nurses. I can't say much about doctors or other health personnel, I mean the multidisciplinary team, but I'm sure they also go through the same process, which is the appraisal. Okay, so health assessment of yourself. There are at times that your employer plays a role. Okay, so that's when you have periodic assessment of your performance. Okay, they help you to actually reassess your capability, your skills as a health care professional. Okay, this time I'm trying to talk about the assessment of you having some me time to yourself and taking an account of yourself, your life. However, not to dwell so much on your life, but your service that you deliver. Okay, how does your assessment or your skills acquired or your skills that you were trying to improve on affects the person that you're dealing with, or your colleagues that you interact with? All right. Okay. Let's take this example, for instance. You are assessing a patient or a client that has come to you. Patient has history, previous history that has been documented on their file. Now, you have the opportunity to actually assess this patient again probably due to some new complaint that has developed, and you found out that this patient is presenting with some other previous problems. Patient has told you a bit about themselves, how they are coping with life and all that. And something in you tells you that, okay, probably what has been documented on the patient file does not tally with how their life is, how they are living, or it doesn't really tally with how they are coping with life. What do you do? Will you reassess this patient, or will you flag this up so that whoever is involved or the other professionals involved will actually reassess this patient, or see that, okay, there's something not quite right? Because sometimes I have come across a situation where a documentation on the patient's file does not match the patient's history that the patient is telling me. You're lucky these days we've got the technology advancement, which is supposed to minimize these errors. However, can you really count on the technology to do all these things? The fact that we've got the technology to actually work for us does not mean that we shouldn't put in our effort as well as professionals or as health personnel. And I will actually stress on the word clinicians. So, me talking about self-assessment as a health expert, this is what I mean. Taking account of your life. How well do you do your work? How well do you do your job? How well do you flag up those red flags? It is very easy because probably you're stressed for time and you just want to get on with some other thing, or you've seen the previous history. This is what has been documented, so easy does it. You just carry on like that and then go ahead, prescribe any medication or recommend any treatment or therapy to make your life easy because it's already there. But has anything that the patient has told you different from what is documented? Yes, we all want the easy life, but does our easy life that we are seeking for affect the livelihood and then the lives and the health of other individuals that come into contact with us? So me talking about health assessment, me talking about self-assessment of you, the health expert, of you, the health professional, this is what I mean. Your ability to be able to flag up or escalate those things that does not do well. Yes, there are some situations, some circumstances, when you flag it up, they will say, oh, it will be ignored. I have been in that situation. But make sure you document it. Make sure that this is what you have noticed and you have flagged it up to so and so. It's not about how do I say it? It's not about snitching anyone. No, you don't have to write the person's name. Yeah, if you flagged it up to the physio, if you flagged it up to the dietitian or whoever it is, just say this was flagged up to so and so at that particular time. So self-assessment as a health professional, very, very important. Now, when it comes to our systems, Do the systems really work in our favor? Do they always work in our favor? Like me talking about flagging it up to your superior or whoever needs to know about it. Do they really work in our favor? Sometimes these systems do not work and you would have to fight to have your voice heard. I'm talking to the one who lives in the community, that individual that lives in the community as well. Sometimes the system does not work, especially if you've led a certain life for some time and hasn't really have to deal with certain systems, and you have no knowledge of the procedures and the pathways to take to actually assess these systems. It can work to your disadvantage. So, to the authorities out there, to the social services, to every health service out there, the primary health care, to the hospitals, the secondary service providers, let's make sure we make the system work. When you get the opportunity to speak with a client or a patient, let's make sure we are able to explain how the system works to them, because sometimes these things work against individuals. Sometimes there is a pathway to take to make people's life easy, but because they do not know, and that has not been made available to them through the primary health care, especially, it works against these individuals. So, life is not fun and games. You withholding information is against the health, it's against the rules. And there is a word I wanted to use, I can't seem to get it now. It's against your practice as a nurse. It's against your practice as a doctor. It's against your practice as a physio. It's against your practice as anyone who is delivering a direct care to any individual out there. No. I remember many years ago, a health an education facilitator I used to communicate with, work with ago, asked me, Janet, do you reflect a lot? Yes, I do. After the day's work, when I get home, I try to assess my performance. Okay, could I have done this better for this patient? Could I have done anything better? Especially when you're faced with those difficult situations. I guess this comes when you are in critical areas, when you are in emergency areas, when you have to deliver care on your feet, when you have to think on your feet. I guess it comes with it. So, those of us playing major roles in the systems that come together to make the well-being of the individuals better, we have a role. We have a big role to play. How well we make people aware that services are available to them to use. How well we educate the public that there are services available. They may be available, but the noise is not being made loud enough. It's not being made loud enough. Let's not come, because I don't think it's accessible to just a few groups. Remember, people's situation change from time to time. So when it changes, what is available to them? So I would plead on those authorities and those individuals working in this services, well-being services, to actually make known, to actually shout about what they do, educate the public about what is available to them. A healthy community makes a happier community, because when you're healthy, you wouldn't be relying on someone else for your daily bread. You would work, you're happy. You've got the you are healthy enough, you are happy, you work, and you put in your optimum best, and the community thrives. So I would continue with just one last point. I know there are some services and some institutions that are doing so well out there. There are institutions that are doing so well out there. And I will say kudos to those institutions and services. And kudos to those individuals in institutions that are failing or that are struggling by trying to make their mark. We should always remember that if an individual in an institution is doing so well and everybody is talking about that individual, that doesn't mean that the institution as a whole is doing great. And if that individual's work is not supported with equal hard working or equal, I don't want to use the word hard working, because hard working can be working hard and not getting or gaining any outcome or benefit from it, making a difference, I would say. And you, the institution as a whole, is failing. Know that you are failing that individual within your institution. So, if there is someone who is doing well within your institution, let that someone be able to influence others. Not in per se taxing the person with responsibilities. That person could be a yardstick to the others. So what do you do to improve the skills and then the knowledge of the others that are also working in the institution? If we have a country with one good, I'll use a university in that country that everyone is seeking to come to, that does not mean that the educational standard of that country is better than other equally working countries who have maybe 3 or more universities that are working maybe just a little below that one that country that has one good university. And that does not mean that your overall educational standard of that country that has a good university is better than the other country that has 3 or more universities that is just working slightly below your good university. So, self-assessment, the year is coming to an end. This is the time for us to assess ourselves, our jobs, our skills, the way we deliver our services. Let's assess ourselves. We all have a role to play. I would end this mixed bag talk here. And yes, the year is coming to an end. I'm sure everyone is trying to celebrate it the best way they can. There may be situations where things are not like they may be before for others, and some may have clocked some milestones, are trying to celebrate it. Some may have had a difficulty and are hoping for the best the following year, and we pray that everyone's wishes come true. Before I end this, I have something to celebrate too. I have actually strengthened, or should I say connected with someone that I so admire, and I'm so happy. Now this is a direct request and a plea to you, private chef Fafa Gilbert. Please consider being part of this club. Yes, for the second time, I did order some of her products, and let me just use the word, it's divine. It's divine. So all of you out there, check on her page, okay? She used to vlog a lot. I'm sure some of her videos are still on the on YouTube. That's Ndudu by Fafa. Okay, I ordered a few things for the family because I could not actually do much in the kitchen this past few days, and I do not regret I did that. Check her out. Please, Fafa, consider being part of the Kente of Expert Club International. Your skills, your knowledge will come in immensely valuable. Please. Okay. As I always say, remember, you and your community are responsible for your well-being. So make it a point to be a positive influence or impact wherever you are. Till I come your way again, I would say keep healthy and bye-bye.